Hello, anatomy learners. Welcome to my channel focused on simplifying complex yet high-yield anatomy. Today we'll label two bones together, the radius and the ulna. First of all, what are they and where in the body can we find them? These are the two bones of the forearm. The radius is the more lateral of the two, meaning that it is on the outward side of the body, the side with the thumb, while the ulna is more medial, on the inward side with the pinky. More specifically, these are the right anterior radius and ulna. The head of the radius is the round disc at the proximal end of the bone. It articulates with both the humerus and the ulna next to it to allow for movement around each. The radius is more prominent at its distal end, where the radial styloid process assists with wrist joint stability. The ulna is shaped the opposite way, with the proximal end bigger and the distal end smaller. The proximal end is called the olecranon, which fits nicely around the end of the humerus, most evident in this lateral view. Distally, while the small ulnar styloid process does not actually form part of the wrist joint, it still assists with its stability. Flipping to the posterior aspect of the forearm, we first need to identify which is which. Without the assistance of neighboring bones, we can still see that this is the radius and this the ulna. How? By remembering the approximate shape of each bone and by making use of those landmarks we just discussed. Remember that they were the radial head, radial styloid process, olecranon, and ulnar styloid process. So those are the foundations of the radius and ulna. Subscribe to follow along for more and comment below if you have any questions or to let me know what bone you want to learn about next. Until next time, happy learning!